beginning of my diagnosis, everything seemed so fear-based, where it was like you had to do chemotherapy or else you would die, whereas the way I view it now is, it's much easier for me to look back and be like, well, now that I know what I know now, would I have done that? No, I wouldn't. But I think, if I had cancer again, what would my answer be to chemotherapy? When I know, talking to my last hematologist, if I did go relapse, they probably would use the same protocol on me, which is scary. But so it's hard for me it's just everything is so fear-based. And so it's hard to have that relationship like you were talking about of rising up and being a strong patient. When you, especially if you've never experienced it before, you don't really know what's right and what's wrong. You just take what the doctor says as absolute truth.
Everybody, welcome back. Today I have the pleasure to speak with a really beautiful woman that I just recently met. Her name is Liddy Lawson, and she has an incredible medical and health story that has so many unique components. I really think it's just critical for all of you to sit down, grab a cup of tea, and really listen to what Liddy has to say.
So we'll just go back to 2020. Probably beginning of 2020, COVID shut down my hair salon in California. So I decided to move from Orange County to Northern California to be with my family, take some time off. I was 36, and I just felt like I just wanted to take a break, take a couple months off, thinking that maybe the salon will open up again one day. So I spent the summer with my folks baking pies with my mom. She was forced into early retirement due to COVID. Just living on my parents' 2-acre property out in the country in Sonoma County. It was
poor you, Liddy.
I know, it was terrible. My childhood home. So got to spend the summer with my niece and nephews, which was wonderful. My brother, my sister, my grandma. It was great. Towards October of 2020, I started to feel ill. So I started to feel like a cold, and I know that kind of scares some people when I tell them that, but it morphed into a severe cold. I thought maybe strep throat. I went to the ER quite a few times. They gave me antibiotics. Nothing was helping. I was prescribed allergy medications. My nose was visibly swollen. It was so congested. I was out of breath all the time. I couldn't swallow very good. My heart was racing all the time. Climbing up this stairs to my bedroom at my parents' house just felt like death. And I actually told my mom that. I said, I think that I might be dying. I had passed out in the shower. It was just very extreme situation. Yeah. So she took me in to the ER, and of course I thought, well, maybe I had COVID, because at that time it seemed so terrible. And went to the ER. They finally did my blood work, which they hadn't quite a few times prior. And they pulled my mom back into me. Don't know how to tell you this, but you have leukemia.
Oh my goodness, Liddy.
That was really shocking to me. For one, I didn't know what leukemia was. I didn't realize that was cancer. I thought it might be like an autoimmune, or it's just my naive mind. So once the doctor left, my mom kind of had to explain to me, like, no, you have cancer. I was like, oh my goodness. So the doctor came back in and told us that they wouldn't be able to treat me at that hospital. It was too dire of a situation. So they said, how do you feel about seeing the San Francisco skyline at night? And I was like, okay, and just wasn't experienced that much with it. Health, extreme health situations haven't really run in my family at all, except for my brother, who is born with a liver disorder. So it was really new. I didn't really know. And I was one to never go to the doctors. I hated it. I never wanted to go, and I was very healthy. I ate right. I exercised. I did all of the things. I didn't do fast food. I just did all the right things, and so
Mhm.
I thought, as long as I'm taking care of myself, I'll be fine. So in that moment, it was just shocking. I think more than anything else.
Yes.
And I don't think it really kicked in until till I realized how severe the situation was. At first, they wanted to ambulance me to the city, which was about an hour and a half away.
Mm.
And then they told me I wouldn't have made it. So they had to helicopter me, which was much less time. So when I heard that, I was kind of like, oh, like this is a big deal. So I think I just wanted to get my whole cold thing fixed, and it was just the leukemia had suppressed my immune system, so I wasn't able to
Mm.
fight it. So
Wow. So you arrive in San Francisco, and what is
did
that? What does your journey start to look like at that point?
well, I got there by myself. It was in the middle of the night, so my mom ended up coming the next morning. Um, I had my first procedure I had to get done was leukapheresis to deplete my white blood cells. They were afraid that I would go into shock or stroke with my how high they were.
Mm.
So once that got taken down, I was able to start chemotherapy pretty soon after. I would say the next week, I think. I was
Wow.
at California Pacific Medical Center in San Francisco.
Wow.
And
So
I found out,
you went in with a cold, and a week later you were in San Francisco getting your first chemotherapy treatment.
yeah,
Wow, Liddy. Okay,
yeah.
continue.
I found out my genetic mutation, which was an FLT3 gene mutation, and an NPM1, which I've heard that FLT3 is pretty high risk. I had acute myeloid leukemia, which is pretty high risk. But I think because of my health, they had, uh, you they were pretty optimistic that I would be just fine. So
Okay.
I started induction chemotherapy and it went great. I loved my nurses there at CPMC. They were great. I'm still friends with them. They'd come in every day and say, "Are you feeling okay today?" "Yeah, I'm feeling great." And they're like, "Okay." And then they'd come in the next day, "You feeling okay today?" "Yeah." And it was kind of shocking at how well I was doing. Of course, I was neutropenic, so I was stuck in my room. And then eventually, I think I was there for like 2 weeks, and my mom was able to visit. And then after the 2 weeks, California shut everything down, so my mom wasn't able to visit. My family wasn't able to visit. So that was really devastating. It's really hard to be in a hospital by yourself, even with wonderful nurses around. I started consolidation chemotherapy, and 2 days into that, my heart stopped twice. My parents were called to come to the city to say goodbye to me. And so they were allowed to come in to do that. Thankfully, my doctor was in my room as I coded and was able to revive me both times.
Wow.
But my kidneys completely failed, all of my organs failed, and the kidneys never returned. So I woke up on dialysis
Hmm.
24 hours a day. I was in the ICU for 50 days with everything under the sun, fungal infections, sepsis, a bowel obstruction that was um, uh, pretty almost fatal. I had to get surgery for that.
Wow.
Uh, I on dialysis every day,
Hmm.
and um, yeah, it was
Liddy,
it was.
I want to pause you. I'm just still trying to imagine that timeline and that process for you. But for the people in our audience who don't know the difference between induction and consolidated chemo, would you mind just explaining that for us?
Sure. So with leukemia, certain kinds of leukemia, you typically do induction chemotherapy first, which for me was a week of infusions. and then with a few days off of a break.
Mhm.
During that time of the break, I had a bone marrow biopsy. And then they go and they take you into consolidation chemotherapy, which is different depending on each leukemia. Mine was a chemotherapy pill that I had to take, and that was supposed to be another 7 days, but I only made it to 2 of those days before everything happened. Typically, from what I've been finding out through my support groups, typically you would continue consolidation, and you would get your results back from your biopsy, bone marrow biopsy, and according to that, you might do another phase or two of consolidation again until they feel that the cancer is gone and your cells are back to normal. Then they would typically either give you a bone marrow transplant just to make sure everything's clean, and then put you on a maintenance chemo that you would take for, I believe people are saying up to maybe 5 years you typically take it.
I see. So I'm guessing maybe people are curious, and I don't know if you have the answer or not.
Uh-huh.
You said that you did well with
Yes.
the initial induction chemo,
Yes.
and then when
Mm-hmm.
things turned over to the consolidated, your
Mm-hmm.
heart stopped.
Yes.
Did the doctors give you any indication as to was it the accumulation over time? Was it one wasn't working out for you? Was it something totally different? Do you have any answers on that?
No, no answers. They were very quiet about everything that happened. They would never give any sort of answers as to, one, like, how did I get the leukemia when I didn't fit any of the kind of description of that type of leukemia.
Mhm.
And two, why did my heart stop? Why did my lungs fill with fluid? Why did my kidneys fail? They don't have any
Okay.
answers.
Yeah, right. And of course, we all know that they do the best they can. It's all well intended. We also know that things happen like this.
Mhm.
Um, Audience knowing, I know, you're not a doctor, but
Right.
intuitively within yourself,
Yes.
even though it may be wrong, do you
Uh-huh.
have any thoughts as to why this may have happened to you?
Well, 3 out of the 4 chemotherapies that I took cause kidney failure, and in the very rare cases. But I have found through my health journey that I'm pretty much always the rare case when it comes to medications. I get
Interesting.
all of the rare side effects.
Yes.
Yeah, I get, I've been paralyzed by the medication. I've had convulsions from medication,
Hmm.
um, just very strange things. So my thought would be it had to have been from the chemotherapy. I'm very skeptical about chemotherapy these days, but I do know it did help me get through the leukemia. I found out actually from my bone marrow biopsy that I had gotten before consolidation. My results came back in December of 2020, and I was cancer free just from induction chemotherapy.
Wow. Okay.
So I
Interesting.
wonder, had I known,
Hmm.
would I have done consolidation? Was it the consolidation that caused my heart to stop? Was it the induction and it just kind of caught up to me?
Hmm.
I don't know. But it seems to me that there's always this protocol of what you have to do in order to reach remission, lasting remission. I'm 5 years, almost 5 years cancer free on induction chemotherapy alone. So
Wonderful.
I believe that there are other ways to reach remission and not necessarily going through the entire
Hmm.
protocol.
I just got goosebumps with your transparency.
So I started dialysis probably, I have a little cheat sheet. I think it was the end of November of 2020. So November 27th of 2020 is when my heart stopped. So immediately after that, I started dialysis. Like I said, I was on it for 24 hours a day. Um, I I never met my kidney doctor when I was at this hospital. My parents never met this kidney doctor. Um, So I remember it being in the ICU, and one of my oncology nurses came to visit me, and I told her, I said, and it
It's
might
taking
have
care of me.
it might have been the ICU delirium. I don't know, but I kept telling her, I said, they're treating me for something different that I did not come in for. I
Mm,
know I came in for cancer, but they're doing something else. I think it's wrong. I don't know what they're doing. And she just was, it's okay. It's okay. She's just very, very sweet woman. You're okay. You're safe. But I just knew there was something different and there was something wrong. And I didn't know what it was. And I couldn't do anything about it. I mean, at this point, I could not move my arms, my legs, my hands. I could barely talk.
and
Um,
why is that? Can you tell the
yeah.
audience why? Yeah.
So I guess just from all of the organ failure, it just shut down everything. And it's incredible how quickly that happens.
Mhm.
Uh, I had something intubated. I was
Intimate,
intubated,
right.
yes. But so I couldn't, I think, and I was just bedridden. I was in bed the
So you just
entire
got weak over
I got
time.
weak.
Mhm.
I couldn't eat. I had an NG tube through my nose. That's how I got my nutrition.
Mhm.
Um, but I was just there. I was just hooked up to dialysis in my room, and I was just kind of barely alive.
Wow, Liddy. Were you in the right mind to start to really question what was going on, or were you just really surrendering to the experience?
I was very much out of it for sure. I know because I was placed into a medically sedated state for I think about a week.
Mhm.
Um, and they were very concerned about when I woke up if I would have brain damage from being without oxygen when I coded those two
Mhm.
times,
Mhm.
which praise the Lord, I don't think I have brain damage. I feel like I'm pretty normal, but I was in the ICU for 50 days straight, and that takes a toll. It's all the medications, all the drugs that they put you on to keep you calm. It's a lot. So it was definitely a very scary time. A lot of, like I said, the ICU delirium with the delusions and whatnot. So I just kind of, and again, I was alone. I didn't have any family with me. They could FaceTime me, and that was it. And that was only if the nurse was in the room to answer the phone for me because I couldn't press the button. So it was, I just was there. My mom, she would call the nurses station every single day, multiple times a day. I know they got tired of her. Um, Trying to just get an update on how I was doing. She tried to come into the hospital multiple times, and they wouldn't let her. They threatened her to yeah, that she's not allowed to come in. Um, she had security called on her a few times. She told them, and it was all COVID, because of COVID protocols, and so
I can't
uh,
imagine what she was going through to not be able to see you.
yeah, it was terrible. It was terrible.
Yeah.
Um, but I think, my faith in God really helped. I have, like I said, my niece and nephews, they're just three little angels praying over me all the time, and singing songs to me over FaceTime, and reading me Bible verses and reading me books. So they read The Lion, the Witch, and the Wardrobe for me, and other books, and it just, having that really helped to just keep me calm, and
Wow.
um,
Hmm.
yeah, yeah,
Wow, it's so powerful to be disconnected from your sources of
yeah,
support, compassion, and love. But like you said, having your faith transcends those limitations. So praise God that you had that and that you were still able to connect with your family and have them support you and pray over you and keep you hopeful.
yes, yeah,
Amazing.
yeah.
Okay, so lead us into the story. So you're on dialysis, you're going through a little bit of, medical induced delusions, and when does a break in this start to happen?
Well, so at the end of December of 2020, I had that risky bowel obstruction surgery. And I think about that time, maybe a little bit before that, I started to kind of wake up a little bit. I was able to actually talk and, actually say words to my family, which was wonderful.
Yeah.
But after the bowel obstruction surgery, I appreciate all the doctors and nurses that took care of me, but the doctors at least seemed to give up on me. They didn't really know what to do. I was very, very sick. My kidneys weren't getting better. They all had thought that they would.
Mhm.
Um, I think acute kidney injury is pretty common with cancer patients,
Hmm.
but they typically do come back. For some reason, my kidneys weren't coming back. Everything else was coming back, but they just weren't. And they just didn't know what to do, it seemed. So we had a friend who had been treated for cancer at UCSF in San Francisco. She said, "I think you need to get her transferred." My brother, like I had said, had a liver condition as a baby. He was treated at UCSF, so we always loved UCSF.
Okay.
And we got in touch with a charge nurse there on the oncology floor, and we decided to transfer me to UCSF. Um, the
Liddy,
hospital, yes,
I was just going to ask you, were there any complications? Did they give you a hard time with the transfer?
yes.
Okay.
So CPMC told my parents that they'll never get me out of there. I will never be transferred. And my mom's kind of like, well, watch us, it's gonna happen. So yeah, so they
What was
said,
their explanation as to why you weren't getting out of there?
I don't know. I don't know.
Hmm.
They just were very again, I don't like saying bad things about people. They're doing their best, but it just seemed very just controlling, like a control type of thing. Same with the whole COVID protocol. My mom said, she'd even get the vaccine if she could come see me. And they said, you could get the vaccine, you'll never see your daughter. So it's just very, I don't know.
Mhm.
So, but we were able to get me to UCSF, and that made the whole difference
Wow.
in life. Yeah. So I was at CPMC from November diagnosis to February of 2021. And on February 13th, I think it was, I was transferred to UCSF.
Wow.
And like I said, that made all of the difference. Again, I was still in remission from leukemia, so that was all fine. I
Right.
met my hematologist. He's an amazing doctor, Neil Donovan, and he was great. He's like, I don't want to put you on any chemotherapy. I don't want to put you on any maintenance chemotherapy. We're not doing a bone marrow transplant. We're just leaving you as you are. And if there's any indication, then maybe. But he was just very like, nope, we're just letting you be.
Wow.
And whereas actually the CPMC oncologist wanted me to continue chemotherapy after everything had happened. And
Wow. You know
same
what I've
thing.
learned, Liddy? One
Uh-huh.
thing about my experience with physicians and hospitals is that number one, they're very different.
Mm-hmm.
So anybody watching, if you're having a bad experience, it is your right to go
Yeah.
somewhere else or to get another doctor. Please always know that because I can't believe the degree of difference
Yeah.
between certain institutions. The other thing is that there are doctors who seem very confident and there are providers and systems that don't. And when they don't have that confidence, they relegate to fear and control tactics.
Yeah.
And those who have the confidence and the chops, I've just seen so many people thrive with these types of systems and doctors who are approaching it the way UCSF did. So praise God that you were there.
Yes, I agree. It was definitely a God thing getting me there. Um, but the best part about UCSF was I got to meet my kidney doctor for the first
You
time.
finally found a kidney
I
doctor,
got
even
a
though
kidney
you were being treated for kidney
Yes,
before you didn't know a doctor. Okay, great. Glad that you finally had a doctor.
finally had a doctor, Dr. Chi Chu. He came in to he's the chief of nephrology at UCSF,
Mhm.
and he came into my room. I believe it was on his birthday, his day off.
Well,
And he said that he is conducting a clinical trial it was called Liberation from AKI. And he and this other doctor, Ian McCoy, have been working on this project, this trial of just that, liberating um, acute kidney injured patients from dialysis. And he said that he really wanted me to be a part of this trial. And he explained that the trial would have two groups. One group would be dialysis is needed according to lab work. The other group is dialysis scheduled, basically what you had been doing. And at this point, I had been doing dialysis 3 days a week for, gosh, I don't know, maybe 4 hours each day, something like that.
Kind of the standard.
Miserable. Yeah, absolutely miserable. And so he wanted me to get into this trial, but it was hard. I had a very hard time knowing what to do, because up until now, it was like I had to be on dialysis. Like, there was no question about it. Everybody told me I had to be on dialysis. And here's this man coming in here and tell me that I might be in the group where it's just according to my labs. And that made me fearful, especially coming from a hospital that stopped looking out for me. And he told me, he said, you will have more eyes on you during this trial than you'll ever want, and so he told me to think about it. And so I talked about it with my mom and my dad. Oh, by the way, my mom was able to come see me the very first day at UCSF. So after, what was that, November, December, January, after 3 months, she was able to see me every day, which was incredible.
Wow. Okay, great. You were at the right place.
Yes. So my parents and I discussed it. We prayed about it at length and decided, might as well. We might as well try this out and see what happens. And, I knew that God would decide which group to put me in. It's completely up to him.
Right.
And God chose for me to be in the group of dialysis as needed, according to labs, which again was very fearful for me. But it gave me the chance to see what my kidneys would actually do. And
how many people get that opportunity ever?
Right. And yeah, because up until now, it was 3 days a week. It had been, every day. It had been 24 hours, So I went, because of my lab work, I went 6 days without dialysis in a row. And that was incredible for me. Anybody listening on dialysis, my experience on dialysis was absolutely a nightmare. I had migraines constantly. I vomited constantly. I was freezing cold all the time. And it was awful. I couldn't picture my life, my future. How do you live on dialysis? I know many, many people do. And I'm amazed at those people that can do it. But for some reason, my body couldn't take it. And I wonder now, maybe I wasn't supposed to be on dialysis for as long as I was. Maybe my body was fighting it for some reason. I don't know. But I looked around at other people getting dialyzed and they seemed okay, but for some reason I couldn't handle it. Maybe it was how sick I was. I'm not sure. But so this was amazing to have this opportunity of not having dialysis for 6 days. I know that doesn't sound like much, but in a dialysis life, that sounds like a year. Like, it sounds like a lifetime. Right. So that was wonderful. I was so happy to have a new doctor that was willing to try to take me off dialysis, because at this point, let's see, it was about 3 months that I was on dialysis. Somewhere in January, February, yeah. And we all know the cutoff date, right, for your kidneys is 3 months. If you're on dialysis for 3 months, you're on it for the rest of your life or until you get a transplant. And so he was really trying to get me to come off of dialysis before that. I was had this small window of opportunity to get placed into Altabate's Rehabilitation Center in Oakland to learn how to walk again, to move my body again. And in hospitals, it's hard to find a bed. It's pretty time sensitive. So we decided that I would leave UCSF and go to Altabate's rehab so I could start functioning again. The problem with that is Dr. Shu could no longer be my doctor, and I could no longer be on that liberation trial. And I had to go back to dialysis for 3 days a week, which was devastating to me. It was devastating, but it had to be done. I couldn't go to the rehab without doing dialysis. It was kind of this kind of thing. I had to do it. I mean, my numbers said that I needed to be, so technically I needed to be on dialysis.
Right.
But at Altabate, the rehabilitation side of things, it was incredible. They really helped me learn how to walk and talk and sit and brush my teeth and
important
take
things.
a shower finally. I was able to do all these things. I mean, it took a long time. I was in a wheelchair for a long time, but the hospital side, the dialysis side of things was not the greatest. They excelled in the rehab, not so much in the other. My dialysis experience there, it was with transportation to and from. It was probably a good 7-8 hour process.
Each time.
And that was 3 days a week after a full day of rehab.
Wow.
And that was really difficult. It was very difficult. I was on a renal diet, so I couldn't eat much. I ended up dropping down to 87 pounds. I went into the hospital back in November, probably about 130, 135. So I lost a lot of weight.
Wow, Liddy, that's 45 pounds.
It's a lot. It is a lot.
Wow.
And the dialysis, it just would make me sick all the time. I constantly would refuse medication just because I'd vomit it up. But it was always on my chart, patient refused medication. Okay, well, if my body won't accept it, but
wow.
So my mom had talked to the nutritionist at Altabates and was very concerned about my weight. She could just see me deteriorating. And so they decided to put me on a feeding tube at that point, which was good. I got some nutrition. It was miserable to have a feeding tube. I don't know how people do that long term, but they just do it. It's incredible. But that helped me get stronger, and I was in Altabates for about a month and was able to go home finally on April 21st of 2021. So I had been hospitalized for about 5.5 months total. So that was wonderful, being able to go home. I got to go home in a wheelchair, and it was short-lived because I was only home for maybe a week or so, and then I was hospitalized again back at UCSF.
Okay.
But I eventually didn't really mind being hospitalized at UCSF because that meant I could see Dr. Shu, and he could kind of see where I was, kidney function wise, dialysis wise.
Right.
I had enrolled in Fresenius dialysis outpatient and was doing that 3 days a week, which was really tough. I remember my first day going there. I was in a wheelchair, was all bundled up with a beanie. I had lost all my hair from the chemotherapy. And I was crying going in there. I just couldn't believe this was my life. Just having my mom drive me 3 days a week to go in here with all of these elderly patients that are just so sick and the sweetest people ever. But it was just very sad. It was very, very sad. And I knew that every time I'd come out, I'd feel miserable, absolutely miserable. But that was just kind of what I had to do. So I continued doing that for a long time.
How long is a long time?
Well, in total, I've done dialysis for 2.5 years, which I don't. I mean, I know you did. You've done it much longer, and I know there's many other people that have done it much longer. But yeah, it was. It seemed like a lifetime because
Yeah, I mean, telling your story of going in the wheelchair and the beanie and being cold and crying, I had the same exact experience. That's like, get up, get on the scale, you're dry weight. And like all of
yeah,
a sudden, I became like, all right, I'm part of a conveyor belt process
yeah,
where it's so difficult to really pinpoint the emotions that I felt in
hmm
there. It was something that I accepted and I surrendered that that was part of my experience.
yeah,
Um, but man, I just felt like I was on another planet and I just would pray to God every day. And I, I literally don't have words for how I felt in that experience going to a DaVita or Fresenius every other day. And like you said, the one thing that gave me hope when I was there were the few hand selected, nurses or doctors who I was like, all right, where's the one in here who actually cares and actually can give me some actual attention? And it's
yeah,
like one or two out of
yeah,
many. That's how it is. And then the couple of people that were your chairmates or,
yeah,
like you, I was very young when I was doing dialysis and I wasn't used to sitting and talking to 70-year-olds all the time.
yeah,
And one thing that really struck with me that was so beautiful, I became friends with a gentleman who was in his 70s, and he told me all about his life. And we became very good friends. And one day he looked over at me and he said, Stephanie, I was in my early 20s at the time. And he said, Stephanie, I'm just like you. My body's just older. And he
yeah,
said, I still feel the same way I did when I was younger. And something really changed in me at that young age in my early 20s to look at people who were older than me so much different. I
yeah,
started to see everybody as, people that were like me, just in an older body. And I just had so much love and compassion for the people I met. But then also, too, those people would come and go. And some days you'd go in and they would pass away and they would be there no longer.
yeah,
So it was just so, I mean, I can just look at you when we probably could give each other a huge hug and just cry about that experience on dialysis. And like you said, some people can brave it and go in and do okay on it.
yeah,
I was not that person. You are not that person. And for anyone out there who's watching it who's not that person, we see you and
yeah.
we love you. So go on with your story. You were on dialysis for 2.5 years, and this brings us to about what year, Liddy? Now.
Well, so yeah, there's a little bit of stuff that happened in the 2.5 years. I decided to try to do home dialysis.
Okay.
That was an experience. Couple reasons why I decided to try that was one, I had heard that it would be better on my kidneys. It would be more gentle. And, with talking with Dr. Shu, he said, the more gentle it is on your kidneys, the more likely you might be able to come off dialysis. And he still was really wanting me to come off dialysis.
Wow.
Excuse me, we had done maybe a trial, one or two trials at this point of while I was at Fresenius to see if I could come off of dialysis. I'd drive an hour and a half to the city to go do blood work every other day. And it seemed like that my kidneys could potentially be well enough for me to come off dialysis, but it just wasn't. It wasn't a sustainable way of doing it, going every day, every other day to the city to do blood work, because then he'd get the blood work results immediately, as opposed to getting it done in town and having him wait a couple days. So, and then the kind of the disconnect between the two, my UCSF nephrologist and my Fresenius doctors, there's just a kind of I don't even know what the
There can
word is.
be it's like a power dynamic. There can be some contention going.
Sure.
I've
Yeah.
experienced that too,
Yeah.
and they don't always play well together.
Right.
Yeah.
Well, and there's such a difference between a dialysis doctor. I know maybe they're called nephrologists, but I always differentiate them with a dialysis doctor and a nephrologist. It seems they're
Mm.
just very different. One is, specifically for dialysis patients. They know how to plug you in. They know how to do all your prescription and adjust it accordingly. Whereas a nephrologist seems a little, at least in my experience, a little bit more about the kidneys and about doing something, for your kidney health. And it just seems a little different. But
Yeah.
anyways, so I decided to try home dialysis. The second reason of doing home dialysis was then Dr. Shu could be my doctor again. Because up until then, he was not my doctor. We would talk on the phone occasionally. And so I went to a home dialysis training center with my mom and my brother. And it was very overwhelming. I'm amazed at all these people that do home dialysis. It's incredible. We were picturing in our mind, we have this front parlor that used to be our homeschool room as kids. My grandma lived there when she was in her last years. We've had family friends that have lived in that room. It's just been like that room. And now it was potentially going to be my dialysis room.
Yep.
Huge machine, all of the equipment, all of the bags of saline because we had well water. It just seemed so overwhelming. But we thought, we might as well. We've done everything up until now. We can do this too. And so we went in for training, and the first day they hooked me up to the machine, and I had a really insane reaction to the machine. The nurse wasn't quite sure what it was, why I was having this reaction, but my heart rate dropped. I started kind of almost convulsing. My brain felt like I had been drugged. It was just very odd. So she thought, well, okay, well, let's turn it off. We'll try again tomorrow. I'll try something different. Go in the next day. It happened again. That happened 3 times. And by the 3rd time, I said, forget it. I'm done. I'm not doing this anymore. I felt like maybe my heart would stop completely. I didn't know if I was going to start seizing. It just was, I didn't want to do it. I'm like, I just can't do this. And maybe it was God saying, nope, this isn't for you. And so I went back into Fresenius dialysis and had a conversation with Dr. Shu. At that time, he told me, so this would have been, I think, October of 2022. And he had told me, I haven't seen anybody's kidneys come back after 2 years. And at this point, it was almost 2 years of being on dialysis. He said, I think that I've given you false hope, and I'm really sorry, but there's no way. There's absolutely no way. And I was heartbroken. I was angry. I was so angry because all up until this point, it was constantly like, no, we're praying. God's going to heal my kidneys. It's going to be fine. Everything's fine. And here is the one person that could help me with this. And he's saying, I'm sorry, I can't do it. So after I got angry, I just kind of, like you, just accepted what my life was going to be. And I had become friends with some of the people around me at dialysis, and I loved my nurses, but I was like, kicking it into gear. I'm so unhappy, but how can I be happy? And that's making everybody else happy. And so I started baking cookies for my crew. I, would bring them presents for birthdays and Christmas. And, it was just like, this is my life, and they were all 70, 80-year-olds, men and women. And I love them to pieces. And we'd have breakfast together, and
Wow.
It was fun. It was great. But I still was very miserable. I, was throwing up every single day. I threw up every day, multiple times a day for 2.5 years. It was awful. I couldn't go anywhere really. Everything and any plans that I made for the weekend would have to be very last minute according to how I was feeling. And most of the time I felt awful, so I wouldn't do anything. I had a huge aversion to food. I got my feeding tube out, um, and had a really hard time eating. Um,
Mm.
I was able to go to church again, but I remember running out of church, vomiting in my little bag, the little blue bags that I'd carry in
Yeah.
my purse, and I'd have in my car, and I'd have in my mom's car, and in my brother's car, and just all over the house. It was awful. Migraines all the time. And I really, again, didn't see how my life would be in the future, living like this, but it was just how it was going to be at that point. But in about that same time, my mom had done some research. She researched all the time. She found the kidney coach, and we put a call into Fiona, and she got us in touch with not Rachel at that, Emily. And then eventually had my now coach is Rachel, and we got me on the supplements, and Rachel was really key in helping me figure out how to eat, what to eat, when to eat, how to make myself want to eat, and because I was afraid too with not having my feeding tube and eating by mouth of like, what should I be eating.
Exactly.
Well, and I think there's a difference too between the nutritionists, because my nutritionist at Fresenius was actually a longtime friend of mine. I grew up with her kids. We did homeschool together.
Oh, wow.
Her daughter and I did ballet together, and so she was like my second mom at dialysis, which was wonderful.
Mhm.
But it's different when
That's right.
you're eating when you're on dialysis, and when you're eating to try to help your kidneys heal.
Right.
It seems very different.
Wow.
So and we were always just concerned about my weight, and it was kind of like, just go get a cheeseburger, just eat something. And I'm like, well, I don't know if I should just eat something, it needs to be good. So it's just different. But so I started taking the supplements from Kidney Coach in September of 2022, started eating according to the Kidney Coach diet in September of 2022. And just kind of accepted life on dialysis, and still had hope and faith that God was going to heal me in whatever way he thought was healing me, which might not be my version of healing. It's just whatever he wanted, and maybe that was being on dialysis, and maybe getting a transplant in the future. But I just kind of had faith that he would figure it out, and I was kind of along for the ride, I guess.
Can I ask you a question quick, Liddy?
Yes.
You said something that's really important. Most traditional healthcare providers aren't very open to a patient starting on some sort of alternative protocol. Yeah. So can you share a little bit of your experience with that, and then your ultimate decision to stay with what you're doing, and how that's really helped you?
Well, at that point, let's see. Well, I didn't have Dr. Shu as my doctor, so it was just my Fresenius doctors. And to be honest, I don't think I really told them anything. Again, I don't want to say anything mean or rude about anybody, because they're just doing what they know to do. But I don't feel like they were very concerned about me and my care. They took care of me. It was fine, but I didn't really think of them as my doctor, even though Dr. Shu wasn't technically my doctor. I thought of him as mine. So I didn't really share with them a lot of what I was doing.
There's a big difference between when you get into the dialysis clinic. I've experienced, because I've been in multiple clinics myself, that the level of care goes to maintenance. And when you have hope and faith, and you have this mindset that you are going to surrender to your story that God is laying out for you, and you're not just going to fall into the traditional narrative, you're seeking and searching for those individuals who still have hope for you somehow within
Yeah.
their own heart and mind and soul. You're seeking this path of healing and upward kind of ascension, not like, well, here we are, and this is just strictly a maintenance protocol. And
Yeah. Yeah. Yeah, it's true. It's CSF. They put in a chest catheter. I had another catheter prior to that, but they put this one in. And every day when I go into dialysis, they're like, you have to get a fistula. I'm not getting a fistula. I'd see what they look like from other people. I think I have scrawny little arms. Of course, it's going to be seen. I did vein mapping, and they said they'd have to do the one up here. I like wearing tank tops. I'm not going to get it. I just was very adamant. And those needles, I always think of them as like the needles that you used to pump up a soccer ball. Like they just look ginormous. And I'm like, I just don't want to do it. I can't do that. And so they, always would tell me the risks of, it getting infected or any sort of water getting into my heart. And it's like, well, I don't care. I'm just not, I mean, of course I care, but, when I'd shower, I'd put, 5 different Tegaderms on top of it and a towel, and I'd have my mom help me wash my hair. It was just, I'm not going to do it. But by the end of 2022, when Dr. Shu told me that there was no hope, it's like, well, I guess I probably should get the fistula. If this is going to be lifelong, I can't have this for much longer. It's been, I had it for 2 years, a year and a half, something like that. No, 2 years. Yeah, which is too long. It's like a year and a half too long. So I decided to set up the appointment. So I set up an appointment for February of 2023 to get the fistula and get my catheter removed. I canceled it because I didn't want to do it. And I decided, okay, fine, I'm just going to do it. I'm setting it up for March. I'm not going to cancel it. I'm going to do it. So March 23rd, I set up my appointment for my fistula. And the beginning of March, I had my monthly call with my hematologist, Neil Donovan at UCSF, just to go over my labs and see how my leukemia was doing. And I was still in remission, praise God. And he told me, he said, I was talking to Dr. Shu about you the other day. And I said, yeah. And he said, I really think you should give him a call. And at this point, I'm like, why? Why? I've been heartbroken so many times now. I don't want to talk to him. I don't want to do this. And so I was talking to my mom, and I said, okay, fine. This is the last time. I'm going to call him. We're going to talk. And whatever he says, this is it. And so he tells me he wants to do another trial. And so, again, of course, I get my hopes up, but I'm trying to be realistic. And I tell everybody on Facebook, I have this fistula surgery on the 23rd of March. Please pray that I don't need to have it done and my kidneys will just miraculously heal, however that happens. And I had dialysis on March 13th at Fresenius. And on the 17th, which was my 39th birthday, I went to UCSF and had blood work with Dr. Shu and met with him. He says, okay, let me look over your blood work and I'll give you a call in a couple days. That was a Friday. On Monday, he calls me and says, your blood work looks beautiful. You're off dialysis. Cancel the fistula surgery and get your catheter removed as soon as possible. And so that would have been the 20th, something like that, the 19th. And on the 23rd, I was supposed to get my fistula out, or fistula put in. And so I was like, this cannot be real. Like, this can't be real. But he told me to get the catheter removed. And I thought, well, if he's telling me to do that, that means something. So I got my catheter removed on the 29th of that month. And on the 26th of June, this month, on 26th of this month, will be 836 days without dialysis, which is how long I was on dialysis, 836 days.
Hey, Liddy, stop so the entire audience can just process that for a minute.
It's a big deal. Yeah.
Whatever went on.
Yeah.
between you and your doctor at that time where he decided to give it another chance?
Yeah.
And that week where he said, okay, Liddy, your blood work looks good.
Hmm.
Stop dialysis and actually get your catheter out.
Yeah. Yeah.
Whatever was coming through him at that time was truly divine,
Hmm.
because I've never heard of this in my life. And I don't know that anybody watching this has heard of it in their life. And
Hmm.
I think that there was something incredibly sacred and magical that was not only going on between the trust and faith that your doctor and you had in just in each other,
Yeah.
the
Hmm.
trust and faith that you had in each other.
Yeah.
But it was very clear that it was anointed and God inspired, because it's just unheard of.
Yeah.
And can you
Yeah.
just tell us one more time how many days you've been off dialysis since that time?
So June 26th of this month is 836 days of no dialysis, which was how long I was on dialysis, 836 days, which is big.
Were you nervous? Were you trusting? What was your mindset like 2 weeks in, 3 weeks in? What was Dr. Shu's mindset, your mindset? I mean, obviously the faith and the kidneys, I mean, everything just was aligned. It was just
Yeah.
aligned.
Well, I kept going in for blood work. I think it was every week. I made friends with one of the phlebotomists there, Franz. He was great. He's like, "You're back again?" I'm like, "Oh yeah." So I was, yeah, every week I would go in to get blood work, and Dr. Shu would say, "Yeah, still looks good. You're fine." Um, Granted, textbook wise, my numbers were not fine.
Right.
I was, I think, off of dialysis, the lowest my EGFR got was down to 10 or 11. Um, and the highest they've gotten ever is 19. So, and I'm currently sitting at 18, which is not ideal, but he kind of is just looking at the big picture of how I feel. Um,
Mm.
I mean, so I came off a diet. You asked about being nervous or how I was feeling. Um, so that was so March, the end of April. My brother, my mom, and I participated with the Leukemia and Lymphoma Society with the Big Climb, which is 2,000 stair steps at the top level of Oracle Stadium, which is the San Francisco Giant Stadium. I did that, 2,000 stair steps, which took a couple hours, and I did it. I vomited halfway through, but I did it. I It was like I was a brand new person. I could do everything I ever wanted to do. I was walking, the next year, actually, my mom, my brother, and I walked a 26.2-mile marathon out in the desert in Las Cruces, New Mexico. It's like I was back to what I was doing prior to getting sick. I have not vomited. Well, that's not true. I have vomited a couple times, but I have not vomited every single day like I was during dialysis. My migraines, I've probably had a handful of them since I've been off dialysis, as opposed to every week, multiple times a week. Um, so I wasn't nervous. I knew that God was in control. I knew I had faith in Dr. Shu. If he thought I was fine, I thought I was fine. Um, he kept saying, if your EGFR gets down to 10, we're going to talk about going back on dialysis. And once it got down to 11, he goes, okay, well, let's say if it gets down to 5, then we'll talk about it. So he just was really, I don't know, he was pleased with how I was doing. And I've never retained water. I mean, I just have always been, or fluid, I just have been pretty healthy.
Lydia, I get a question. Tell me what it means to you to have a provider believe in you the way that Dr. Shoes believed in you. Can you please, because a lot of people, they've never experienced this. And can you just tell our audience what it means to have a provider who is courageous to go outside of the box and believe in you and create this relationship with you?
I mean, this may sound extreme, but it's the difference between life and death. Because I know that, I mean, I would not be what I am today if it weren't for Dr. Shu. And it's like it's hard because there are doctors out there that are Dr. Shu, but they're not a lot. And I know that I'm just very fortunate. I know that it was definitely God that got me to UCSF, you know, and I look back at my time at CPMC and as horrible as it was, I mean, if it wasn't, I wouldn't have gotten to UCSF. I wouldn't have met Dr. Shu. I would have still been on dialysis, you know? So it's just, it's overwhelming, to be honest, to have a doctor like Dr. Shu. And it makes me sad that there's not more of him because there
Yes.
needs to be. Yeah, but he's doing a lot too. He had me send in a video testimonial that he showed at the Kidney Week. Well, it was right after I got off dialysis, and he was one of the speakers at Kidney Week, and so he did that. We've co-authored an article for a medical journal together. We had Stat News, which is a local news station up in the Bay Area, came out and interviewed him. He has an interview segment for him and one for me. We have a couple articles written about us. So he's trying his hardest to get, you know, to change the narrative. And because of that, I was approached to be on a couple different patient advocate committees, which I find is such a blessing to be able to. I know I'm not very smart when it comes to all the medical jargon, but it just makes, I feel like my situation kind of worth it, my medical journey worth it, to be able to share and try to help future kidney patients.
Absolutely, Liddy. Absolutely.
Yeah.
Absolutely. This is what we need more of in the medical institutions.
Yes.
For this magic to happen, it was really a relationship between the system, the
Mm-hmm.
patient, and the provider.
Yeah.
And then the support that all of those elements had around it.
Yeah.
So, I mean, I believe too that, you know, there are other Dr. Shoes out there.
Yes.
It's just we need to be plugged into that environment of the systems on board, the providers on board, the patients on board, and the surrounding elements. It's like a magic formula, perfect recipe. And so yeah, I'm praying that more of this can be seen. I'm so glad that you're doing what you're doing, advocating, giving patients hope, challenging the provider narrative.
Mm-hmm.
And I'm glad Dr. Shu is willing and courageous to do that too. That's so amazing. So tell us about your life right now. What does life look like now for you?
Well, life right now is very different. My family and I moved out of California, which has been very hard. We're living in Knoxville, Tennessee. We're out here to be closer to my sister and her family who live in Virginia. And yeah, life's pretty slow. You know, out here, I haven't been doing much. You know, I just spend time with my mom and my family, and my mom and I are we just opened an antique booth that we sell antiques from, and so we love hunting for antiques every weekend, and hoping to get plugged into more patient advocate committees, and yeah, just kind of seeing where God takes me.
What's mom's name?
Not a whole lot of plans. What was that?
What's mom's name?
Debbie.
I just want to say hi to Debbie. Thank you, Debbie.
Yes.
Caregiving for your daughter. I mean, I can't imagine what she goes through as your mother, but the fact that you guys are so close and being a caretaker can be exhausting too. So sending much love to you, Debbie. Thank you for taking such awesome care of your sweet, beautiful daughter, Liddy. So that kind of support is really key too in this whole process. When people don't have that kind of love and support, it makes a world of a difference.
I know I'm very fortunate to have the parents that I have. You know, I'm 41, living in my parents' house, you know, not working. But it's really, I'm very fortunate because I do know there's a lot of people out there that don't have a family life quite like I do.
Yeah.
And I just am very, very fortunate to
And
have.
it's clear that God has you in a way.
Yeah.
And, like you said, from going to where you were to finding your hospital, UCSF, and the whole process, as many downs as there were more ups, obviously. Look at you
Yeah.
now. You're here. You have this incredible
Yeah.
story. And I'm just delighted and excited that you're here and that you've been in this situation to share with everybody. And I honestly can't wait to see what you do in the future. And just the fact
Yeah.
that you were able to come off dialysis 2.5 years in with the
Mhm.
right elements and providers and care, and you've been off for 2.5 years is just completely and utterly groundbreaking and can offer so much hope to so many people. So thank you so much for taking the time to
Sure.
chat. Is there any messages, any final things you'd like to leave with our audience?
Yeah. I would definitely say that don't just go with the flow. There's options out there, and I would highly recommend people look into clinical trials because you never know where they're going to take you. I mean, I've been met with quite a few negative people that don't agree with what I've done. You have to do this protocol, and you can't reach lasting remission unless you've done all the things, and you can't ever get off dialysis if you've been on it for 3 months. And yes, you can. So I would say don't just settle for being told what to do. Look for alternative medicine like kidney coach and supplements. There's plenty of things out there. Make sure that they're quality, and like kidney coach is. Yeah, my Dr. Shu was not a fan of kidney coach, and I've had other doctors tell me you need to get off supplements, but Dr. Shu doesn't worry about that now. He sees that they've done nothing harmful for me. So I think, yeah, look into research. Try to stay away from prescription meds as much as possible. I mean, there are alternative ways out there.
Mm.
And like Stephanie said, if you don't like your doctor, find a different one because that can make a world of difference. You don't like your hospital, find a different one. Um, yeah,
And
but
one of my favorite things about meeting you and having these similar experiences is that we both have a really powerful faith.
Mhm.
And, I remember when I started dialysis, and just because you have faith doesn't mean that you don't get down and depressed.
Right.
Just
Yes.
because you have faith and
Definitely
you
not.
believe in God doesn't mean you
Yeah.
don't get anxious and fearful.
Yes.
It's a part of the process.
Yeah.
But there's something about, like you said, you were talking about that little seed, that little nugget within you that just knows that you are being guided, even though it's very, very hard. There's
Yeah.
just this little tiny piece of trust that if you can find that within
Yeah.
you, if you can tap into that faith, it
Mhm.
does allow you to start to surrender to these uncomfortable feelings and to this process. And eventually you start to see that there's actually a rhythm and a purpose for a lot of the things that I'm going through. It's leading me to my next step if
Yeah.
I'm willing to listen
Mhm.
and to challenge what doesn't intuitively feel right for me. So it's difficult because as patients, we're talking about this mature approach where we're not in denial of the conditions that we have.
Right.
We're not talking about just going rogue and saying, I'm not taking any medicine and I don't
Yeah.
have this
Yeah.
disease when clearly you do. We're
Yeah.
talking about the ability to hold it all, to
Yeah.
hold the fact that we have a diagnosis, but also to hold this hope and to stay connected to our heart and our intuition, even in the face of this adversity and challenge. And if more people do that, you can see how it just starts to fragment the system as we know it, because sadly, we do have a system that's overburdened, uh,
Mhm.
underfunded potentially. And what happens, like you said in the beginning, is that we just fall into the system running in a way where it's you surrender your autonomy to the protocol. And if not, we're going to try to control it. And that sort of attitude doesn't leave any space or room for this novelty and these pioneering relationships to start to cultivate. And when you let room for that pioneering relationship, could you imagine if all Dr. Shoes just all of a sudden started to pop out in different institutions?
Yeah.
It's gonna disrupt. It's a disruption. But
Yeah.
in my mind, it's the healthy, sacred disruption that actually the Western medical model could use at this time. So I'm just, again, so utterly in awe to meet you, Liddy, as a fellow sister with, CKD, and a little bit of a rebel as well, and a
Yes.
sacred rebel at that.
Yes.
So I'm just so grateful to meet you, and thank you for telling your story. And anything else before we stop today?
I think we covered a lot. Yeah.
Okay.
Yeah.
All right. So, everybody, I'm going to leave Liddy's email below if you'd like to reach out to her and tell her how awesome she is, and thank Debbie for all her hard work. And yeah, and if you have any other questions, feel free to reach out to me as well. And thanks so much for joining us, and we'll see you soon.
They know what's best, but
Right. I think a lot of patients do. It is, you're afraid because you want to survive in the beginning of the
right.
process, and then with the projection of the fear-based model and how it operates, most patients learn through hindsight if
Yes.
they're lucky enough to get to the other side. And then they say, well, I would do this different, and I wouldn't do this, and I
Mhm.
probably wouldn't do that. So
Right.
it is one of those things where it does take the right formula
Hmm.
and provider to not start the relationship out fear-based, and to
Right.
say, okay, here we are. This
Right.
is our options. And do we want to go on a journey together and try some unconventional things? And I'm here for
Yeah.
you, and I'm going to monitor you. Or do we just want to go the route that we've always gone and see what happens?
Yeah. 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 Which is scary to do the other too. It's scary to try something different, but um,
But look at you. You're all
yeah,
in.
yeah. In my situation, it was kind of like, well, it can't get any worse than it already is, so might as well try something different. And God gave us herbs, as medicine, that's what our food should be, is medicine. We shouldn't be eating all this junk that they shove down our throats, So I think, why not go to the beginning, back to the beginning, and do it the way that we were supposed to.
Yeah,
Um,
I have one last question for you. How important, besides the patient-provider relationship, how important is food, relationships, your faith-based living? Like, how important are those elements? Because those are things that never get talked about, and the health of that
right.
around your illness experience. So, how important is that for you?
It's incredibly important. I had a doctor tell me that food has nothing to do with kidney health. And I thought that cannot be true. I know it's not true. And so like before, I guess before diagnosis, I felt like I ate healthy, but of course I'd go and grab In and Out, every once in a while, and have a Dr. Pepper with chips, and but now I don't do that. I don't. Any of that stuff. It's chemicals. It's just shouldn't be in our bodies, and like I said before, the risks of acute myeloid leukemia was being an elderly male smoker. I'm like, well, I'm not either of those three things. And the other one was exposure to certain chemicals like formaldehyde. And I am a hairstylist, and I specialize with children. And so I never did hair color in my salon. I never did any chemical services like Brazilian blowout or anything like that. But I worked in the Sola salons with other salon owners around me that did those things. And we had the same air ventilation. And I just wonder if a lot of that has to do with the reason why I am the way that I am, or, food that I had been eating or drinking, chemicals in the air, all of those things. And so now I am very specific with what I eat, what I drink, even the water from the tap. We have an RO system. It's like everything needs to be. I'm not afraid. I'm not going to go do certain things because I'm afraid. I just want to treat my body like the temple that God tells us they are. I want to put the right things in my body. I think food is medicine, 100%. Relationships, same thing. I don't want stress in my life. I want happiness and joy in my life. And those are the people that I surround myself with. Um, I used to drink alcohol. I don't drink alcohol. I think not only that the alcohol can cause the problems, but the environment you're in when you're drinking alcohol is just not uplifting. And so there's that. My faith in God has grown astronomically since all of this. I just remember being in the hospital in the very beginning, just being like, well, what else am I going to do? I'm just going to pray. I don't have anybody to talk to. I had my Bible and I had my devotionals, and my niece and nephews would teach me Bible verses, and I just repeat them in my head all the time. And that's just, I know it's hard because people often reach to God in the horrible times and not in the good times. But now I do both. I thank God for the kidneys that I have because He made them strong. At 18 EGFR, they are strong. They're kicking, and I'm so grateful for that. I thank God that He put me in this situation that I can now be an advocate for other people and talk to people like you. And I think just turning your mindset on the situations you've been in and how God uses everything to the good of those who love Him, And I think more people need to realize who God is and how important He is in your life. And I don't know necessarily if the people watching, if your situations will end up like Stephanie and mine, but just know that God, if you love God, He's going to work them all out for your good. And however He sees fit for that, He's going to give you strength to go through whatever you're going to go through. Just make sure you're holding on to Him really tight, because if you're not, then kind of out of luck.
I so beautifully said, Liddy. Thank you so much. You're a total rock star.